What is Mpox? Signs and symptoms. Mpox, formerly known as monkeypox, is a rare viral infection primarily found in West and Central Africa. While there has been a recent increase in cases in Europe, the overall risk of contracting the infection remains low. How Mpox spreads. Mpox can be transmitted from person to person through several means. Close physical contact, direct contact with Mpox blisters or scabs, including kissing, hugging, or even holding hands. Contaminated objects, touching clothing, bedding, or towels that have been used by someone with Mpox. Respiratory droplets, inhaling the coughs or sneezes of an infected person when in close proximity. In West and Central Africa, Mpox can also be contracted from infected rodents, such as rats, mice, or squirrels, in the following ways. Bites, being bitten by an infected rodent. Contact with infected animals, touching the fur, skin, blood, body fluids, spots, blisters, or scabs of an infected animal. Consumption of undercooked meat, eating meat from an infected animal that hasn't been cooked thoroughly. Mpox in Europe. Although there has been a rise in Mpox cases in Europe, the infection remains rare, and the overall risk to the general population is low. You are extremely unlikely to have Mpox if you have not been in close contact, such as touching someone's skin or sharing towels, clothes, or bedding, with someone who has Mpox or show symptoms. You have not recently traveled to West or Central Africa. Symptoms of Mpox. After being infected with Mpox, it typically takes 5 to 21 days for symptoms to appear. The initial symptoms often include high temperature, headache, muscle aches, backache, swollen glands, shivering, exhaustion and joint pain. A rash usually appears 1 to 5 days after the onset of these symptoms. It often begins on the face and then spreads to other parts of the body, including the mouth, genitals, and anus. Some individuals may also experience anal pain or bleeding. The rash is sometimes mistaken for chickenpox. It starts as raised spots, which develop into small fluid-filled blisters. These blisters eventually form scabs that later fall off. Symptoms generally resolve within a few weeks. However, during the symptomatic phase, you can transmit Mpox to others. Preventing Mpox. While Mpox is a rare infection, taking precautions can help reduce your risk of contracting or spreading the virus. Here are some key prevention strategies. Avoid physical contact. Refrain from close physical contact, such as touching someone who has visible symptoms of Mpox or who exhibits symptoms consistent with the virus. Practice good hygiene. Wash your hands frequently with soap and water, especially after contact with potentially contaminated surfaces or people. Use hand sanitizer if soap and water are unavailable. And disinfect surfaces regularly, especially if someone in your household has Mpox. Avoid sharing personal items such as bedding, clothing, and towels with someone who has Mpox. And avoid sharing personal items, such as utensils, toothbrushes, or razors, with others. Be cautious with wild animals where Mpox is prevalent, particularly with rodents like rats, mice, and squirrels, as they can carry the virus. Also, ensure that any meat from any animal in the affected regions is thoroughly cooked before consumption. Stay informed. Keep up to date on travel advisories and outbreak information if you are planning to visit areas where Mpox is more common. And keep informed about local health alerts and follow any recommendations from health authorities. By following these precautions, you can significantly reduce your risk of contracting or spreading Mpox. We hope you found the information in this video useful.
Symptoms and treatment of flu. Even though flu can get better on its own, it can make some people seriously ill. First, let's go through the symptoms of flu. They are a sudden high temperature, an aching body, feeling tired and exhausted, a dry cough and sore throat, a headache, difficulty in sleeping, a loss of appetite, diarrhea or tummy pain, and feeling sick or being sick. The symptoms are similar for children, but they can also get pain in their ears and appear less active. There are a number of ways to treat flu yourself at home. These are Rest and sleep. Keep warm. Take paracetamol or ibuprofen to lower your temperature and treat aches and pains. Drink plenty of water to avoid dehydration. Your urine should be light yellow or clear. You can also ask a pharmacist for treatment advice and recommended flu remedies. Remember, antibiotics do not work for viral infections such as the flu. So doctors will not recommend antibiotics for flu treatment unless they suspect a bacterial infection also. We hope you found the information in this video useful.
Signs and symptoms of cancer. It's important to be aware of any new or worrying symptoms of cancer, as spotting cancer in its early stages means it's easier to treat. If a doctor suspects cancer, they'll refer you to a specialist, usually within a few days to 2 weeks. Here are a list of signs and symptoms that could indicate cancer. 1. Changes in bowel habits. Speak to your doctor if you've noticed these changes and it's lasted for up to 3 weeks or more. Stomach discomfort, blood in your stools, diarrhea or constipation for no obvious reason, a feeling of not having fully emptied your bowels after going to the toilet, pain in your stomach or back passage, your stool is loose, pale, or looks greasy. 2. Bloating. If you've had bloating for 3 weeks or more, then speak to your doctor. 3. Bleeding. You should also speak to your doctor if you have any unexplained bleeding, such as blood in your urine, vaginal bleeding between periods, vaginal bleeding a year or more after the menopause, also known as postmenopausal bleeding, bleeding from your bottom, blood when you cough, blood in your vomit. 4. Coughing, chest pain, and breathlessness. If you've had a cough for 3 weeks or more, then contact your doctor. Symptoms such as shortness of breath or chest pain may also be a sign of a condition such as pneumonia. 5. Lumps. If you notice a lump in your breast, or if you have a lump that's noticeably increasing in size elsewhere on your body, then you must contact your doctor. It's important to regularly check your breasts, underarms, groin, and testicles for any new lumps or changes. 6. Moles. Speak to your doctor if you have a mole that changes shape or looks uneven, changes color, gets darker or has more than 2 colors, starts itching, crusting, flaking or bleeding, gets larger or more raised from the skin. Any of the above mentioned means there is a chance you have malignant melanoma, which is a form of skin cancer. 7. Unexplained weight loss. You should also speak to your doctor if you've lost a lot of weight over the last couple of months that cannot be explained by changes to your diet, exercise, or stress. 8. Tummy or back pain. If you have pain anywhere in your tummy or back and you're not sure what's causing it, then speak to your doctor about it. This includes a dull pain that's always there or a sharp pain that comes and goes. 9. Indigestion and heartburn. Some cancers can give you indigestion, or heartburn and acid reflux. This can feel like burning in your chest or make you burp or hiccup more than usual. Speak to your doctor if you get any of these symptoms regularly and are not sure why you're getting them. 10. Itchy or yellow skin. If your skin is itchy and turns yellow, or the whites of your eyes turn yellow, also known as jaundice, you should speak with your doctor. 11. Feeling tired and unwell. With some cancers, the symptoms can be harder to notice. It's important to speak to your doctor if you think something is not right or you keep feeling tired and unwell and you're not sure why. It's important to note that people have a higher risk of getting cancer if they have been diagnosed with another condition, which means they could be at a higher risk of getting cancer also. 2 or more of their close relatives, such as a parent or a brother or a sister, have had cancer. Remember, early detection can help treat cancers better and effectively, so seek advice from your doctor if you feel the need to. We hope you found the information in this video useful. Dysphagia is the medical term for swallowing difficulties. People with dysphagia either have problems swallowing certain foods or liquids, and some people cannot swallow at all. Main signs of dysphagia include coughing or choking when eating or drinking, sometimes bringing food or liquid back up through your nose, a sensation that food is stuck in your throat or chest, persistent drooling of saliva, and being unable to chew food properly. Over time, dysphagia can also cause symptoms such as weight loss and repeated chest infections. You should see your doctor if you or someone you care for have difficulty swallowing or any other signs of dysphagia, so you can get treatment immediately. Early investigations can also help to rule out other more serious conditions such as esophageal cancer. Causes of dysphagia. Dysphagia is usually caused by another health condition, such as a condition that affects the nervous system. For example, a stroke, a head injury, multiple sclerosis, or dementia. Cancers such as mouth cancer or esophageal cancer, and gastroesophageal reflux disease. This is when stomach acid leaks back up into the esophagus. One of the most common problems of dysphagia is coughing or choking, when food goes down the wrong way and blocks your airway. This can lead to chest infections such as aspiration pneumonia, which requires urgent medical treatment. Aspiration pneumonia can develop after accidentally inhaling something such as a small piece of food. Dysphagia in children. Children can also have dysphagia as a result of a developmental or learning disability, such as cerebral palsy. If children with long-term dysphagia aren't eating enough, they may not get the essential nutrients they need for their physical and mental development. Children may also find mealtime stressful, which could lead to behavioral problems. Treating dysphagia. Treatment usually depends on the cause and the type of dysphagia. Many cases of dysphagia can be improved with careful management, but a cure isn't always possible. Treatments for dysphagia include speech and language therapy to help people recover their swallowing through special exercises and techniques, changing the consistency of food and liquids to make them safer to swallow, other forms of feeding, such as tube feeding through the nose or stomach, surgery to widen the esophagus by stretching it or inserting a plastic or metal tube, also known as a stent. Remember, always consult your doctor for advice if you have difficulty swallowing or any other signs of dysphagia, as getting immediate treatment is important. It's important to note that people with dysphagia can often choke on their own food, and this can result in death if emergency medical services are not contacted immediately. We hope you found the information in this video useful. NAFLD, non-alcoholic fatty liver disease. What is non-alcoholic fatty liver disease? This term refers to a range of conditions caused by a buildup of fat in our liver. The condition is usually seen in people who are overweight or obese. It's important to note that a healthy liver should contain little or no fat. Early stages of NAFLD does not usually cause any harm, but it can lead to serious liver damage, including cirrhosis, if it gets worse. There are four main stages of NAFLD. These are simple fatty liver steatosis, a largely harmless buildup of fat in the liver cells that may only be diagnosed during tests carried out for another reason. 2. Non-alcoholic steatohepatitis, also known as NASH. This is a more serious form of NAFLD, where the liver has become inflamed. 3. Fibrosis. This is where persistent inflammation causes scar tissue to develop around the liver and nearby blood vessels, but the liver is still able to function normally. 4. Cirrhosis. The most severe stage, occurring after years of inflammation, where the liver shrinks and becomes scarred and lumpy. This damage is permanent and can lead to liver failure and liver cancer. It can take years for fibrosis or cirrhosis to develop, so it's important to make lifestyle changes to prevent these conditions getting worse. In the early stages of NAFLD, There are not usually any symptoms. You may not realize you even have it unless it's diagnosed during other tests carried out for another reason. Occasionally, people with NASH or fibrosis may experience a dull or aching pain in the top right of the tummy, extreme tiredness, unexplained weight loss, and weakness. NAFLD is often diagnosed after a blood test called a liver function test produces an abnormal result. The condition may also be spotted during an ultrasound scan of your tummy. Most people with NAFLD will not develop any serious problems, but if you're diagnosed with the condition, it's a good idea to take steps to stop it getting any worse. There's currently no specific medication for NAFLD, but making healthy lifestyle choices can help you improve your condition, as adopting a healthier lifestyle is the main way of managing NAFLD. It's also important to note that NAFLD is not caused by alcohol. However, drinking alcohol can make it worse. Therefore, it's recommended to either cut down or stop drinking alcohol completely if you have NAFLD. We hope you found the information in this video useful.
What is an anal fistula? An anal fistula is an abnormal connection or tunnel that forms between the inside of the anal canal and the skin around the anus. It often develops as a result of an infection in an anal gland that leads to the formation of an abscess, a pocket of pus. When the abscess doesn't heal completely, it may leave a persistent tract, which is known as the fistula. There are 5 common symptoms of anal fistula. 1. Pain, especially when sitting or during bowel movements. 2. Discharge, such as pus or blood that may leak from the opening of the fistula. 3. Swelling. This occurs around the anus. 4. Reoccurring abscesses. This continues to occur even after treatment. 5. Fever or chills. This happens when there is an active infection. There are 4 main causes of anal fistula. These are 1. Anal abscess, and this is usually the primary cause. 2. Crohn's disease. This is a chronic inflammatory bowel condition. 3. Trauma or surgery that has occurred to the area. And tuberculosis or cancer. These conditions can lead to fistula formation, but is very rare. An anal fistula is diagnosed in 3 ways. The first is a physical examination, so a doctor may feel the tract. Imaging, such as MRI or ultrasound, may be used to map the fistula, and proctoscopy or colonoscopy, which is used to inspect the anal canal and rectum. There are 3 main types of treatments. 1. Surgery, which is often necessary, such as fistulotomy or seton placement, to heal the fistula. Medications, such as antibiotics or biologics, if associated with Crohn's disease. And proper hygiene, to prevent further infections. Remember, early diagnosis and treatment are key to avoiding complications, like recurrent infections or incontinence. So if you suspect an anal fistula, consult a doctor or colorectal surgeon as soon as possible. We hope you found the information in this video useful.
What is angina? Angina, also known as angina pectoris, is a type of chest pain or discomfort caused by reduced blood flow to the heart muscle. It is often a symptom of coronary artery disease, where the arteries that supply blood to the heart become narrowed or blocked. It is not usually life-threatening, but it is a warning sign that you could be at risk of a heart attack or stroke. Types of angina. Stable angina. This is predictable and occurs when there is exertion or stress. It lasts a short time, usually 5 minutes or less, and can be relieved by rest or medication. Unstable angina. This occurs unpredictably even at rest. It's more severe and lasts longer than stable angina. It is not necessarily relieved by rest or medication, and this requires immediate medical attention as it can indicate a heart attack. Variant angina. This is caused by a spasm in the coronary arteries. It usually occurs at rest, often at night, and it is relieved by medication. Microvascular angina. This involves the heart's smallest arteries. It can occur during normal daily activities and last longer, and it is common in women. Symptoms of angina. Chest pain or discomfort described as pressure, squeezing, burning or tightness. Pain that is radiating to the shoulders, arms, neck, jaw or back. Shortness of breath. Nausea, fatigue, dizziness, and sweating. Causes of angina. There are many causes and contributing factors to angina, such as coronary artery disease. This is when plaque builds up in the arteries. Coronary artery spasm. This is a sudden tightening of the muscles within the arteries. Anemia, when oxygen carrying capacity in the blood is reduced. Hypertension, also known as high blood pressure. Smoking, this damages and narrows blood vessels. Diabetes, this affects blood vessel health. High cholesterol, this contributes to plaque buildup. A sedentary lifestyle, this is when exercise is not a part of a person's lifestyle routine. Obesity, this increases heart disease risk. Diagnosis of angina. Certain tests may be carried out to diagnose angina. These are electrocardiogram, ECG, it measures the electrical activity of the heart. Stress test, this monitors heart function under stress. Echocardiogram uses ultrasound to create images of the heart. Coronary angiography uses dye and X-rays to visualize the coronary arteries. Blood tests, this checks for markers of heart damage. Treatment for angina. Lifestyle changes such as having a healthy diet, regular exercise, not smoking and managing stress. Medications such as nitrates to relieve pain, beta blockers to reduce heart workload, calcium channel blockers to relax blood vessels, statins to lower cholesterol, antiplatelet agents, for example aspirin, to prevent clots. Medical procedures such as angioplasty. This procedure opens narrowed arteries using a balloon and sometimes a stent. Coronary artery bypass grafting. This creates a new pathway for blood to flow around blocked arteries. Prevention of angina. There are many ways to prevent angina, such as having a healthy diet that focuses on fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise, at least 150 minutes of moderate aerobic activity per week. Stop smoking. Seek help if you need to stop smoking. Manage stress. Techniques like meditation, yoga, or counseling can help. Monitor your health. Regular checkups to manage blood pressure, cholesterol, and diabetes can help keep things in check. Remember, understanding angina is crucial for recognizing its symptoms early and getting the appropriate medical care needed. Consult your doctor or healthcare provider for more advice. We hope you found the information in this video useful.
Alzheimer's disease is a condition that affects millions of people worldwide. It is the most common form of dementia. It's a progressive neurological disorder that impacts memory, thinking, and behavior, making daily life increasingly challenging for those affected. What are the symptoms of Alzheimer's disease? The symptoms of Alzheimer's can vary, but they typically begin with mild forgetfulness, or struggling to recall recent events. As the disease progresses, individuals may experience difficulty completing familiar tasks, problems with language, such as forgetting common words, disorientation, including getting lost in familiar places, mood changes, like depression or irritability, and in later stages, they may struggle with basic self-care and recognize close family members. What causes Alzheimer's disease? The exact cause of Alzheimer's is not fully understood, but scientists believe it involves a combination of genetic, environmental, and lifestyle factors. At the core of the disease are abnormal protein buildups in the brain known as amyloid plaques and tau tangles, which interfere with brain cell function and lead to cell death. Risk factors include advancing age, family history of Alzheimer's, certain genetic mutations, poor cardiovascular health, like high blood pressure or diabetes. Can Alzheimer's be prevented? While there's no guaranteed way to prevent Alzheimer's, research suggests that a healthy lifestyle can reduce the risk or delay its onset. Here are some recommendations. Stay physically active with regular exercise. Engage your brain through reading, puzzles, or learning new skills. Maintain a heart-healthy diet, such as the Mediterranean diet. Prioritize quality sleep, as poor sleep has been linked to cognitive decline. Manage stress through mindfulness or relaxation techniques. Stay socially connected to combat isolation. What treatments are available? While there's currently no cure for Alzheimer's, treatments can help manage symptoms and improve quality of life. Medications like cholinesterase inhibitors or memantine can temporarily improve or slow the progression of symptoms. Non-medical therapies are equally important, including cognitive behavioral therapy to address mood changes, music or art therapy to stimulate the mind, structured routines to reduce confusion and anxiety. Caring for someone with Alzheimer's can be overwhelming, but support is available. Reach out to healthcare professionals, support groups, and community resources to navigate this journey together. Remember, early detection and proactive care can make a meaningful difference. Thank you for watching, and we hope you found the information in this video useful.
Are you suffering from an itch that just won't go away? It could be a sign of an underlying medical condition. Here are some causes for an itch that may require medical attention. Dry skin can cause itching, and this increases with age as our skin gets naturally drier, and many people find that once the heating goes on in the winter, their skin dries out and the itching worsens. Allergies. This can be in response to something you have eaten, or you have come into contact with something, and will usually resolve once you have identified the triggering cause. Insect bites, stings, infection or infestation can all be causing factors towards any itching you may be experiencing. Changes in a mole or a new mole. The back is a common place to have moles. We cannot see them easily ourselves, and itching in a new or existing mole could sometimes be a sign of cancerous change and should be reported to your doctor. Psychological reasons for itching. Sometimes people itch when they are nervous or stressed. General anxiety, depression, and obsessive-compulsive disorder can all trigger increased itching. So treating the underlying cause is key. Neurological reasons for itching. If a nerve is compressed, this can cause itching. Metabolic causes for itching. Itching can also be a sign of liver, kidney, or thyroid problems. It can also occur with iron deficiency known as anemia, and in certain malignancies such as myeloma and lymphoma. Hormonal causes for itching. Pregnancy can cause itching. This can simply be due to the tummy skin stretching. Itching can also occur during the menopause due to the change in hormone levels. It's important to note that regular and prolonged itching should not be ignored. A doctor can help you find out the underlying root cause of this problem and can advise on treatment. So remember to seek medical advice. We hope you found the information in this video useful.
What is ataxia? Ataxia is a term used to describe a group of conditions that make it harder for the body to coordinate movements. It can affect balance, speech, and fine motor skills. People with ataxia may struggle with tasks like walking, eating, or writing, and some may also have trouble seeing or swallowing. The symptoms of ataxia can vary depending on the type and severity of the condition. Ataxia is generally divided into three main types: acquired, hereditary, and idiopathic late-onset cerebellar ataxia, or ILOCA. Acquired ataxia happens when something damages the brain or nervous system, such as an injury, stroke, or multiple sclerosis. Hereditary ataxia is caused by faulty genes passed down from parents, with Friedreich's ataxia being the most common. Idiopathic late-onset cerebellar ataxia involves slow, progressive damage to the brain, though the exact cause is unknown. Ataxia usually happens when the cerebellum, the part of the brain that controls balance and coordination, gets damaged. This damage can come from an underlying condition like multiple sclerosis, a head injury, or even long-term alcohol use. While there is no cure for most types of ataxia, treatments can help manage symptoms. These treatments may include speech therapy to help with speaking and swallowing, physical therapy to improve movement, and occupational therapy to make daily activities easier. Some medications can help with muscle spasms, bladder issues, or other symptoms. In a few cases, addressing the underlying cause of ataxia can improve or stop it from getting worse. The outlook for ataxia depends on the type. Some forms stay the same or even improve, while others can gradually get worse over time. People with hereditary ataxia often have shorter lifespans, but many live into adulthood. For acquired ataxia, recovery depends on the cause, and some cases can improve. Learning about ataxia and supporting those who have it can make a big difference. If you or someone you know has symptoms like poor coordination or balance issues, it's important to seek advice from your doctor or healthcare provider, as early diagnosis and treatment can help. We hope you found the information in this video useful.